Hello everyone, you're watching sqadia.com, and now we are moving on to one of the last topics, that is bone marrow edema syndrome. It's highly rare cause of osteonecrosis, but because the normal blood supply of the bone is such that majority of the blood is actually endosteal, that is the neutron artery enters into the diaphysis, then it descends and ascends, giving out ascending and descending branches, and these ascending branches eventually supply the inner side of the medullary cavity, also inner two-thirds of the cortices, while outer to one-third is usually supplied with the periosteum. So majority of the cortex and medullary cavity is actually supplied from the endosteal blood supply. So if there is edema over this area, then majority portion of the bone is actually either receiving low blood supply or actually not receiving any. So this may eventually result in infarction and ischemic necrosis of the bone. We'll be going through the etiology, what are the X-ray and MRI features of bone marrow edema, and what is the pathogenesis and treatment. It's a rare, painful condition of unknown etiology affecting mostly adult men and pregnant women. If you see it over here, this is a T1 weighted MRI and this is the T2. But usually on the T2, it's actually the water appears bright. On T1, the fat appears usually bright in case of MRI. If you see on the T2 images, you can see that this part of the femur has actually, there's a lot of edema, there is a lot of inflammation, and probably this is undergoing some kind of ischemic changes. Similarly is the case with the tibial condyles as well. So what is etiology? This includes transient osteoporosis of the hip, regional migratory osteoporosis, reflex sympathetic dystrophy. What actually happens is sometimes there's maybe the reflex sympathetic dystrophy means in which there is actually due to parasympathetic and sympathetic activity, there's an abnormal sympathetic activity which results in contraction of the arterioles, leading to decreased blood supply for some time, eventually leading to osteonecrosis. Coming what affects how this etiological pathway affects the bone is this is a normal bone. The insult has now occurred. Why? This could be any cause. This could be due to either edema or it could be due to reflex sympathetic dystrophy in which the arterioles are actually shrunk. This leads to bone compromise, eventually leading to bone marrow edema. And further, the reparative mechanisms are actually initiated. But sometimes the repair is actually 100%, that bone becomes normal, and sometimes eventually the reparative mechanism is not just enough, eventually leading to bone necrosis or gradual resolution and bone necrosis. What happens is that if the normal resolution has occurred, the bone has repaired itself, there will be no changes on X-ray and MRI. But if the bone insult was so much that the edema was severe enough that bone has not been able to repair itself, this would eventually result in necrosis. Now this is an MRI, it's a T2 weighted MRI. If you see it over here, this femoral head is actually necrosed as compared to this side, especially on the right side. So what is the difference between a transient bone marrow edema and osteonecrosis? It's very slight differences, but sex distribution is almost, in case of male to female, bone marrow edema is more common in females, especially in pregnant females. Predisposing factor is pregnancy, but why this pregnancy is actually predisposing factor to bone marrow edema, the cause is still unknown. Onset in case of edema is really acute, but in case of osteonecrosis, it's prolonged, it's a gradual onset. The clinical progress is usually edema is self-limiting. It may be severe enough leading to necrosis, but osteonecrosis is actually progressive. Once the dice has been rolled in, then eventually this process has started, which eventually lead to osteonecrosis. Then on X-ray, bone marrow edema may only show osteopenia, that is, the bone will be definitely soft, but there will be no pathology. But in case of osteonecrosis, there's usually marked whitish coloration is called as sclerosis, which is actually abnormal lines which is seen on the X-ray, and they are lines of abnormal density because the bone is probably dead by that time. On scintigraphy, there's increased activity and there's reduced activity because normal cells have actually dead in osteonecrosis, But in case of bone marrow edema, there is actually inflammatory response. So there is actually a maximum activity which is seen on the bone scans. In case of an MRI, there may be diffuse changes, but in our case of osteonecrosis, there will definitely be sequestrum and involucrum. There will be a nidus which will be present in case of osteonecrosis. And in histology, bone marrow edema, there will be minimal bone death. But in if you see that bone on the slide where osteonecrosis is acted, probably all the bone would have dead by that time. Thank you very much. Keep watching sqadia.com.